This page of the study guide is for the bones and sinuses of the head and neck region. So first of all, I will be talking about the cranial bones of our skull. This is like a top-down view. Towards the top is the anterior portion, and towards the bottom is the posterior. We have the frontal bone, the ethmoid bone, the sphenoid bone, and then on the sides we have the temporal bone. These are paired, there's two of them. And then there's also two parietal bones on the sides. And then in the back we have the occipital bone. And then we have this hole, which is the foramen magnum, not a bone, but still important. It's where all this stuff for the brain passes through. In total, we have 8 of these cranial bones. Moving on down, we're going to talk about the bones that make up the face, aptly named the facial bones. A lot of these are paired. So we have the zygomatic bones on both sides of the cheekbones. We have the maxilla bones, also paired. We have the mandible, which is the lower jaw. And then we have a bunch of these little tiny paired bones. First the nasal and the lacrimal bones. And then deeper we have the vomer in the center and the inferior nasal concha, which are these yellow guys here. And then we have the little palatine bones. So those are all the bones that make up our face, and there are 14 of them. Next we have these little tiny bones, which are in our ears and help us hear. They vibrate in response to changing pressure in our ear canals. These are auditory ossicles. We have the malleus, the incus, and the stapes. There are 3 of these on each side. So there are 6 total. Next we have the 7 vertical or cervical vertebrae in our neck, where we've moved into the neck region now. So C1, which is the uppermost vertebrae, is called the atlas. C2, which is below that, is called the axis. And then we have C3 through C7, which all kind of look like that. Finally, we have the hyoid bone. This is like in our throat. This bone is important because it supports the tongue above it and the trachea, which is below it. And it helps us do things like move our jaw. This is a CT image where you can see the hyoid bone. I'm going to go ahead and outline it here for you in green. This is attached to a lot of important cartilage too. So just to summarize everything, we have the cranial and facial bones, 22 in total. After that we have the little tiny auditory ossicles, 6 total, and the cervical vertebrae, these are 7 in total. And then the hyoid bone, there's just 1 of them. So in total in the head and neck region we have 36 bones. I'm also going to be talking about the sinuses, which are some of the spaces that are in these bones, usually empty, can fill with fluid and stuff, and there are 4 total. First is the frontal bone. A lot of these, or actually all of them, are named aptly based on what bone they are located in. So that's the cranial bone, the frontal one there, and I have some CT images of these as well to show you guys. A lot of these came from Dr. Saltamachia's lecture. So I'm going to outline these in pink. This is our frontal sinuses. Again, this is looking, from above or below. An axial image there. Alright, so after that we're going to have the ethmoid sinus, or sinuses, again in that ethmoid bone. On the side you can see it in purple. I don't remember. Oh yeah, I chose blue for the ethmoid for this section for whatever reason. Seems like I switched it around a little bit, but yeah. And these are pretty wavy looking, so pretty distinctive on a CT scan. Okay, the next one we're going to talk about is the sphenoid sinus. I bet you can guess that this is in the sphenoid bone. Let's get a new color here, orange. And this is going to be more posterior than the ethmoid sinus. There we go. And then lastly, we have the maxillary sinuses, located kind of towards the front of our face in the maxilla facial bones. You can find the blank note page, like before I started on this lecture,